We're talking about the growing list of stars who are going public with the problems they've had in the quest to stay young. Desperate Housewives actress Dana Delany revealed this week that a Botox procedure she had left her with a dead nerve and a drooping eye. But is Hollywood open to a more, let's say, natural look and less plastic surgery? Our Andrea Canning went in search of these answers. Good morning, Andrea.
Good morning, Robin. Well, it seems less is more these days in Hollywood. And it's not just leading ladies having buyer's remorse, but also regular women who are trying to look like their favorite celebrity and then later regretting it. I visited a plastic surgery practice devoted entirely to reversing procedures.
Lisa, right here.
23 years ago, Rinna had silicone injected into her lips to achieve this signature look, a supersized, sexy pout. But today, she's back to au naturel after having lip reduction surgery this summer. She says she had the surgery because, quote, I no longer wanted my lip to be what defines me.
I cannot pick Lacey up today. I have surgery in a half an hour and I'm late already.
Actress Dana Delany, seen here in her new ABC series Body of Proof, is also coming clean, telling Prevention Magazine that a bad Botox experience has made her swear off plastic surgery forever.
You stop.
Give me a big smile.
Buyer's remorse is even on the mind of this Kardashian sister.
So we'll start with Botox, and we'll see where this takes us.
In a recent episode of Keeping Up with the Kardashians, Kim gave Botox a try.
Does it hurt?
Yes.
I'll never do this again, ever.
Oh, promise?
Never.
Promise?
Promise.
Plastic surgery has become something that's become an addiction in Hollywood, and women are going overboard with breast implants and lip implants. And they don't look like themselves, they don't look normal, they don't look natural, and I think that there's a huge backlash now.
Last year I met up with Linda Evans, famous for her role in Dynasty. But she didn't look like the same Crystal Carrington.
I've made some choices that I've gone, whoops.
Are you willing to say what your mistakes were?
No, I think anyone who looks at me will tell. I don't need to go into details, but people know what you should look like and then why you don't.
Then there's Heidi Montag, the poster girl for going too far.
Triple D isn't enough?
Well, see, it doesn't look very big, you know.
At just 23, she radically altered her appearance, as she told our Juju Chang.
I'm not addicted. If I were addicted, I would have had 10 plastic surgeries and look like...
You did have 10 plastic surgeries.
Well, I mean 10 times.
Today, Montag says she regrets that decision, announcing just months after her surgery, I'm desperate to go back to normal. I'm downgrading and going a little smaller, to a D or a double D. I feel trapped inside my own body. 39-year-old Julie Levine knows that feeling all too well. The LA real estate agent decided to have lip enhancement surgery 15 years ago after noticing luscious lips were the trend with stars like Angelina Jolie.
Everyone was doing silicone back then, and that's what I did, and it looked really, really good for a year.
But the look came at a price.
Lumpy, turning hard, the silicone had moved. Scar tissue was developing around the area that I got injected.
So she came to Dr. Richard Ellenbogen, a Beverly Hills plastic surgeon who specializes in reversing procedures.
I have a whole practice of people coming in doing that. Some things are not totally reversible, but we're able to fix many of the things that even 10 years ago were unfixable.
Julie needed 2 surgeries, but now she's back to her original lips. Check out her before and after the surgery. She's never been happier.
My lips are soft again, they feel different, and I'm very happy with the results.
Even in Hollywood, where the pressure to be physically perfect never lets up, actresses are starting to realize that looking the part may mean looking like themselves.
I think that women want to be taken seriously. I think that they want to look young and gorgeous, but they don't want to look like a caricature.
And the surgeon told us a lot of big stars have come to his practice for reverse plastic surgery, but he can't go too extreme with the reversal because they're so famous. He doesn't want to alter their looks too much in the other direction, or else people will notice right away. Now back to the one celebrity I know who never ages. Miss Robin Roberts.
It's early. Thanks, Andrew. Joining us now to talk more about plastic surgery is Leslie Jane Seymour. She is the editor-in-chief of More magazine and wrote an editor's letter this month about letting women age however they choose.
Isn't this poster child for aging how you want to age?
Exactly.
It's incredible, and I think that's the trend.
What inspired you to write the letter?
Well, we get, I run More Magazine, and no matter what we do, if we do beautiful, great hair, great lighting, great makeup can make you look amazing. So the problem is there's been so much discussion lately about retouching and over-retouching that even when we don't, I get my readers writing in saying, why did you do that? And I'm like, wait a minute, I didn't. Actually, it's just lighting, hair, makeup, and we fight with photographers to actually put the wrinkles back in. And that they've been so trained to take a 50-year-old woman or a 40-year-old woman and make her look 20 in Hollywood by the PR people that we fight with them. I said I could make a whole magazine just based on the wrinkles I put back in.
Really? And you said it's not about looking younger, but just looking you just want to look your age.
You want to look great for your age. And I think that's what you're seeing in Hollywood is that there's a backlash to wanting to look like you've had work done, wanting to look younger. I don't think any woman out there would say today, I want to look 20 years younger. She says, I want to look great for my age.
Absolutely.
And that's a whole new movement. And that's a good thing.
So is the pendulum swinging in Hollywood?
Well, I think it's swinging everywhere. And I think the idea is, remember today, you don't have to have a radical, a lift. You can do injections. You can do small little things, tweaks. You don't have to have that big wind-blown, as poor Linda Evans said, when you go too far. And you don't have to do that anymore. You can, great skincare has developed so far. A lot of that can be taken care of by how you maintain yourself.
I couldn't help but notice you as you were watching Andrew Canning's piece, and when we saw all
scary.
And why were you nodding along and you were just really moved by it?
It's just, because it's so sad. I find it so sad that women emulate these stars so much that they think they want to look like them and become them. And, when you know a lot about Hollywood and you've spent a lot of time with them, they look great on the outside, but they got the same problems we do. And really emulating them and trying to have their lips isn't going to change your life. The change has to happen in here. And it's how you feel and how you feel about yourself. You look great, and how you project yourself to the world. A lot of it, I know it sounds cheesy, a lot of it is inner.
No, it's not cheesy, and it is. And it's funny because someone will say to me, oh, you look good, have you had work done?
Right.
And I'm like, no, I just got a good night's rest.
Right, exactly. Well, and I think that's what women are after. They're after, looking like they had their best day, or it is their best day.
Now, why are we just talking about women here?
Oh, well, men too. Yes,
really,
I know. They're in there.
You look and see, and they're doing things as well.
They're in there.
We don't talk about it as much. There's not much discussion about that.
Well, but remember, it's okay for a man to age. There's that commercial about, I forget what it is. It's some hair tonic thing that says, just a touch of gray, and that's okay. If you look too gray, it's not good, but some gray. Try that on a woman. There's not one thing that would say a touch of gray is going to make you look experienced and actually keep the job. It's a different standard, as we know. It's a very different world for women, unfortunately.
So where do you think we're heading from here?
I think it's good news. I mean, I think I've got all my readers online talking to me about this issue because I wanted to throw open the door and talk about when is too much, what is a right amount to do, and are you angry? A lot of women are angry that they feel pushed to do too much in terms of beauty surgery and changing themselves and altering their age. They want to look their age. They want to look great.
Great for their age.
Yeah, great for your age.
Thank you.
Absolutely.
All right, appreciate it very, very much. And tell us what you think about all this, the Hollywood's love affair with cosmetic surgery and what we're doing. So go to abcnews.com/GMA to weigh in on our shout-out board, as you suggested. And there's also a link to More Magazine's coverage of this controversial topic.